So how we create that homeostasis is balancing all of this. And this is where that triangle lies right here. We want to find a balance here. This is how we should be assessing our patients. So how do we bring this in? Well, the first, of course, is that awareness, the health promotion, the disease awareness for the patient. We're looking at the patient education. Then we go into screening. Where is our risk assessment? What is that patient's overall risk of periodontal disease? How is their home care? What is involved in the overall risk assessment? Then we look at the treatment. How are we going to diagnose that treatment? What is our plan? How are we monitoring? And what is that access to care? And when we look at the adherence, what is the compliance to the therapy? What is the chronic management? And this is taken from palliative care, what we see in hospitals. And I think this is so great. Historically, they're targeted to remove calculus, and calculus removal is important. But the most destructive substance in the mouth is that biofilm. The biofilm is what is creating and carrying all of those pathogenic bacteria. All patients can benefit from the technologies of the detoxifying powders that are out there with targeting bacteria subgingivally. So the first powder that we're going to cover tonight is erythritol powder. And the clinical science of the erythritol powder showed that at month 12, test sites were less frequently positive for AA bacteria. And what they did is they followed the patients who were receiving erythritol powder every 6 months. So this is just 2 recare visits. And they were able to show that they're less frequently tested for AA bacteria. Erythritol is more effective than xylitol or sorbitol at managing oral health endpoints. And this was published in 2016, the International Journal of Dentistry. Erythritol has also been shown to suppress the maturing of gingivitis biofilms in vitro and promote biofilm compensation that is more consistent with early colonizers rather than the pathogenic species. The glycine powder is safer on implants. There's less trauma. It's more effective with biofilm removal. Overall, that glycine powder is amino acid, and it works to, again, detoxify subgingival. The glycine powder is safe around implants. The erythritol is a thinner powder. Whatever product you're using, you have to make sure the product matches the manufacturer's recommendations or manufacturer's unit. When we're working with our patients, how do we keep them comfortable? How do we be effective? Well, one of the great products from tonight's sponsor is Voca, the Voca and Mirror Protect. And this is something that I have loved working with chairside. In fact, I think I'm one of the only hygienists that loves it as much on their KOL team, but it's biocompatible. And they have a claim where it permanently eliminates the hypersensitivity. My longest patient using this product is 2 years. I applied it once, and it's a light curing desensitizer. This is life-changing for patients that are struggling with that sensitivity. So by slowing down, by creating this environment for both us and the patient, by allowing us to have more time in our schedules, this is what is going to be critical when we look at managing non-surgical perio. It's going to be much harder to manage perio now than it was 20 years ago because of the food we're eating, because of the stress that we're under, because of the social isolation. We're still under it. Let's be honest. COVID changed the game forever. Also because of the mouth breathing, because of the increase of the sleep disturbances that we're under, for the sedentary lifestyles that our patients live from working from home so often. All of these things are going to be factors. So when we're looking at building that protocol moving forward, the other thing that we need to be thinking about is what our patients' personalities are. And when we look at those personalities, how we are handling and addressing what we are seeing chairside.